Every single day, public health officials are up against a really tough, almost impossible choice. In our communities, the health needs are practically endless, but the resources we have to fix them, they're definitely not. So how do they decide what gets top priority? That's the huge question we're going to break down right here. Seriously, just try to put yourself in their shoes for a second. You've got a limited budget. Do you tackle the opioid crisis, rising obesity rates, the overwhelming need for mental health services? What comes first? The problem that affects the most people? The one that's the deadliest? Or maybe the one that's costing the economy millions? There are absolutely no easy answers here, but there is a system for making these tough calls.
So here's how we're going to break it all down. We'll start by really looking at this impossible choice. Then we'll get into how officials even find the real problems. After that, we'll open up the toolkit they use to judge a crisis, see how they make the final decision, and finally, wrap up with why this whole process is so important for getting things done. All right, let's dive right into Section 1, the impossible choice. This is all about why we simply can't do everything all at once.
And that brings us to the key idea here, prioritization. Now, this isn't just about making a simple to-do list. It's a formal, structured process for ranking health issues. The entire goal is to channel our limited resources, we're talking money, staff, time, and attention, to the places where they can make the absolute biggest impact. It's really about being strategic and proactive, not just reacting to whatever fire is burning brightest that day.
Okay, so that raises a big question, right? If you're going to rank problems, you first have to know what they are. Section 2 is all about that first step. How do officials figure out what's really going on in a community?
Well, they use what you could call a two-pronged approach. On one side, you have all the hard data, things like community health surveys, formal needs assessments, and ongoing surveillance data that show all the trends and statistics. But numbers don't tell the whole story, not even close. That's why they also have to get the human side of the story. This comes from things like interviews with community leaders and just getting a handle on public perception. Because what a community feels is a major problem is often just as critical as what the spreadsheets say. Okay, so you've gathered all this info, and now you have a list of potential problems. Now comes the really hard part. How do you compare them? An opioid crisis versus, say, childhood asthma. In Section 3, we're going to look at the diagnostic toolkit officials use to evaluate these very different issues side by side. First up, and this one's pretty straightforward, is the sheer size of the problem. Officials start asking some really basic but crucial questions. How many people are actually affected by this? Is this an issue in just one neighborhood, or is it widespread across the entire city? And a really big one, is the trend getting worse over time? This gives them a clear sense of the scale of what they're dealing with.
But, of course, size isn't everything. A problem that affects fewer people might be way more serious. And that's our second criterion, severity. How bad is the impact on a person's life? Here, we're talking about the potential for real pain and suffering, for losing the ability to function, for severe disability, or even death. A rare disease that's incredibly deadly might rank a lot higher here than a very common cold that's just an annoyance.
Then, you got to zoom out and look at the bigger picture, the impact on society as a whole. What's the total cost of this health issue? And this goes way beyond just hospital bills. It includes all the indirect costs, like lost productivity when people are too sick to work. This is where the problem really gets measured in dollars and cents, and those numbers can be staggering. Now for a major dose of reality, feasibility. I mean, it's one thing to point out a huge, scary problem, but can we actually do anything about it? This criterion asks that critical question, are there effective, evidence-based solutions that we know work? A problem that has a clear, proven, actionable solution might just jump to the top of the list over a massive, complex issue that we honestly don't know how to solve yet. And finally, we have what is an absolutely vital criterion, equity. Because public health isn't just about doing the most good for the most people, it's also about justice. So this asks, is this health problem hitting vulnerable or marginalized groups disproportionately hard? Tackling an issue that's making inequality even worse might become a top priority, even if its overall numbers seem smaller than another problem. All right, let's move on to Section 4. We've got all these different criteria. How in the world do you pull them all together to actually make a final ranked decision? So how do you turn all this thinking into an actual decision? Well, one formal method they use is called criteria weighting, and trust me, it's way simpler than it sounds. First, you just list out those criteria we just talked about, size, seriousness, and so on. Then, and this is key, you assign a weight to each one depending on what's most important to your specific community. After that, you score each health issue against every single one of those criteria. And finally, you just do the math, multiply the scores by the weight.
What you get is a single data-driven priority score for each issue, which gives you a nice clear ranking from top to bottom.
Now, a really important question. Who is actually in the room when these decisions get made? The answer is stakeholders. And it's so important to understand what this word means here. It's not just some corporate buzzword. It's not just the government officials or the doctors. A stakeholder is literally anyone with an interest in the outcome. That means community leaders, local nonprofits, and maybe most importantly, the actual residents themselves.
And this quote from the source material really just hits the nail on the head. For any of this to actually work, the process has to be participatory. It has to involve everyone who is concerned and who will be affected by these decisions. When you do that, you build a real foundation of trust. And let's be honest, people are way more likely to support a plan that they actually had a hand in creating.
And that brings us to our final section, from priority to action. What's the real-world payoff for going through this incredibly detailed, collaborative process? Why bother? So what's the bottom line here? Why does all this matter so much? Well, for starters, it gives you a clear, logical reason for every single decision you make. No more just because. Second, it makes everything you do more effective because you're targeting real, identified needs. Third, like we said, bringing the community into the process builds massive trust and acceptance. And finally, it practically creates a roadmap for collaboration by showing you exactly who your partners and allies should be.
And that really is the whole process. We've walked through the entire framework, from spotting the problems to creating an action plan. But this isn't just some theoretical exercise for officials in an office somewhere. So I'll leave you with this question to really think about. Using the criteria we just went over, what do you think is the #1 health priority in your own community and why?